Essentially, we have shown that decreasing food intake in polycystic kidney disease in a humanized mouse model decreases the burden of this disease. Okay, so it's a very, very common disease. It's the main cause of genetic related renal failure in humans, for example. There is no treatment at all at this point that's been approved. And the only thing that can be done is dialysis or renal transplantation. And we have found that a very simple measure, like decreasing the amount of calories that you take, even by only 10%, can decrease very significantly the burden of this disease. So we have done actually a dose response, okay, all the way to decreasing calories by 40%. And we actually started with 10%. So 10% for a normal human being, okay, would probably mean eating 1 or 2 cookies less than they would normally, or maybe 2 cans of soda that they would take. So it's actually not a very drastic measure at this point. 10% caloric restriction is not something that's intolerable. Most people probably could and should have a cut on their calories by 10%. We actually saw that even the main effect, it's observed about 25 to 30% cuts in calories. And the other finding that's very interesting is the fact that we can not only prevent the disease, okay, but once the disease is established, okay, we can actually rescue those animals with the caloric restriction. So it's not only a preventive measure, but also can be used for treatment. If you're cutting about 40%, you're cutting a fair amount. And as you know, there are people that actually do caloric restriction for life, usually on the range between 25 to 30 or so. And they do well. They actually have a better cardiovascular profile, but it's a very tough thing to do. So one of the main issues with caloric restriction is that most people probably wouldn't tolerate. Okay? So one of the things that we are really trying to do at this point is A, how much caloric restriction do we really need? And we know it's not the really stringent caloric restriction. Only 10% would be enough to ameliorate the disease and delay the onset of renal failure, for example. The other thing is to understand how caloric restriction is doing this. Okay? So if we can figure out what are the pathways that lead to the effect of caloric restriction in polycystic kidney disease, we could come up with either drug combinations or even a combination of drug and diet that could be effective for this disease. The truth is that we don't actually know the impact in humans with polycystic kidney disease yet. And the truth is that the majority of us take more calories than we need. Okay? So it is very likely, based on what we know on the animal models, is that some mild restriction of calories could delay the disease in humans. Okay? And again, I'm not talking about cutting 40% of your calories. I'm talking about something very mild, 10%, that would mean, again, not eating that dessert or not eating or drinking some soda or something like that. The other thing that we don't know yet, and we are trying to figure out in the animal models, is what kind of calorie do we need to cut? Okay? Is it fat? Is it sugar? Or is it protein? So we need to figure that out too.